Okay, welcome. Good morning, everyone, and welcome to our 9 o'clock strategic planning meeting. It is July 11th, 2022. Let the record reflect that all three commissioners are present, our executive management team. And first on our agenda is Marcia Malsa with the figure this out with the Redeem Foundation. So I'm Marcia. I'm going to let you introduce yourself and then go ahead and start your presentation.
Thank you, first of all, everyone, for having me here today and giving me the opportunity to present this. So if we go to slide 1, we're just Race Redeem Foundation. The vision and mission statement are up there. Essentially, we work towards removing the silos of the community in relationship to drug misuse and addiction. We are working with several organizations trying to do to really empower our community to fight addiction and have a healthier community. I do, on a side note, and mention we don't focus on this in verbiage, but we also are very cognizant that much of substance use disorders just go hand in hand with mental health. And so we try to work with a lot of agencies on that as well. We are a 501c3 organization, nonprofit. All donations go directly into our programs. We have a separate account for operations that's privately funded. So that's what we are. Next slide, please. So why the Race Redeem Foundation? Just giving you a quick update, and then we'll get into really the meat of what you folks need to hear or want to hear. So I lost my nephew, Race, to fentanyl, and the worst day in my life was my first day of learning about fentanyl. And it was the same day I found my nephew dead. And it was because of fentanyl, I had to call my brother, my parents, and my son, own children, and tell them they lost their best friend and cousin. And it's just not right to do that. It's not wrong. People shouldn't have to have those conversations. And hearing Race's mom's reaction will haunt me the rest of my life, to hear her mournful cry. So that gave me the fire in my belly to fight fentanyl. Again, we really work on addiction. It's not anything bad. It's a disease. If Race died of cancer, everyone would go, I'm so sorry. When you say died of an addiction, they're pretty uncomfortable. They don't know what to do. And so we try to educate on that. So that's the encompassing idea of the foundation, is we work on removing the silos. We try to help people find resources in prevention, treatment, recovery, and support. Support is really important to clarify. We do support for those in recovery. You've been in treatment for a year. How do you get a job? How do you do this? So there's programs like Al-Anon. All of those are very valid, but we also need other programs to support their mental health, their well-being. But we also need support for families or friends who have a loved one that's dealing with addiction. What triggers, what, where are your boundaries so you stay healthy, even though there's a terrible disease in the person you love? So we work a lot on that. And I talked about, we really work hard at bringing groups together, not working separately, but working inside as coalitions, collaborators. Next slide, please. Real quick, as I said, we like to work in the community, and above is just some of the things we work with, organizations we work with. That's not all of them. We really focus on sustainability. So when we partner, or work or collaborate, we're there for the long term, not just a project. And I really have worked hard at getting the foundation to work with universities because of their research base and their knowledge that a nonprofit would not normally have. So that's why we have a couple different universities up there. Next slide, please. So as we learn more and more about addiction, it's how do we empower our community to fight it? So they aren't embarrassed about it, but they want to get better. They want to address this. So these are a small sampling of what the foundation's programs we have. We're going to talk about addiction help finder in a minute under the Fentanyl Project. Foundation race sounds very random, and it is. That story is a personal story. Is my brother Kevin, Race's dad, has always been a racer. Our family raced snowmobiles and he raced cars, and he's owned a race team for over 30 years. And they traveled states and whatnot. But when Kevin lost race, this crazy group of guys who go out and take each other out every night in the dirt and, you know, turn left and go hard, were the first group there for my brother, and to this day still support him. They're teddy bears after all that. But so my brother was just in awe of how much support, and that's not just from Washington. They're in Indiana, they're in Florida, they're in Australia, they're in Canada. They have been there from him from the first minute they heard. So my brother decided to pay him back and do a foundation race. So what that means is he personally puts the purse in. He puts the winning prize in. It's not from a foundation, but we get to go in, take over that race town for a weekend, talk about addiction, help them understand it's a disease, listen to the community, let them tell our stories because we're safe. We find a like-minded nonprofit in that racing area and donate in Race's honor to, so that community knows of a place to go for resources. So that's a random one, but we do it. Same thing with Eastern. We are working with a music mentorship program there. That's to honor Race. He loved music. He loved composing music. And we just sat with Eastern, and we're with Shaw Middle School, actually. That's a high-risk group of kiddos. And we're trying to get the college students to mentor them, work with them. We're going to get those young kids on college knowing, on the college campus, knowing they can do that college is attainable. Take them to a show, take them to the opera, do what? Because they don't get that experience. So we're very hands-on. We try, like addiction, it doesn't discriminate. It goes into our area. So our programs are always looking for an audience we can touch and help them get healthy. Next slide, please. Now we get to fentanyl. So what is the urgency of fentanyl? And why are we so all of a sudden everyone talking about it? I learned about it the hard way 6 years ago, as I had said. And from that day, I wanted to run out on the streets personally and tell everyone, but no one listens to a crazy aunt. So I had to find another avenue to get that through. We have been working with the DEA, and they have phenomenal data for us. And I want you to look at this data. It's in 1 year, and it's going to be very similar, my guess is, for 22. But in 2021, 186% increase in fentanyl overdose. Now, what's important to remember when you look at these numbers, they're low because we have Narcan that doesn't get recorded. So someone ODs, that is not a recorded OD. So that is really an actually much higher number. Again, it doesn't discriminate. It could be someone that you know in this boardroom. It could be your kiddo's school, it could be your sister, it could be your best friend. Someone's going to be hit by it in some way. This DEA seized 1,089% in 1 year increase. And then the amount that the DEA has seized in 21 kill every American. And people don't understand. I mean, that's hard to comprehend, one, but we're not aware of how dangerous, how scary this is. A really simple analogy of all of this is from our guest speaker from our spring summit was a 737. If that crashes and everyone dies, I want you to just think about that. We've had this happen, unfortunately. The media that goes on about that all day, all week later, you're still hearing about it. Fentanyl is a plane crashing every day with that many people dying every day. you don't hear about it. So that is something to really resonate of how are we going to get into our community and how do we make it safe. So, next slide, please. So the Fentanyl Initiative that I proposed to you folks and want to talk about, these 3 programs under the foundation all integrate fentanyl. And I've tried it over years, and this finally came up with the most simple form of trying to help everyone understand. So I'm going to just explain each one. And I really hope that if I'm not making sense, you'll stop me and ask questions and take, I love questions, so don't feel bad. So we have an addiction help finder, the Narcan training, and then SAFE. All of them in some format will touch on prevention, treatment, recovery, and support in both groups of families and the person in recovery. Next slide, please. So our addiction help finder, I'm super excited about this. We're launching it this August. It is a website that we have created. It's affiliated with Race Redeemed Foundation, but it's its own entity, it's its own website for the reason our vision is growing this throughout the state, throughout the country. When you have, I don't know if any of you have dealt with anyone in an addiction situation, but when you do, and you're trying to find help, it is a nightmare. You go Google, find a treatment center, they're full, doesn't take your insurance, won't take this. It's just over and over and over. And then you find the perfect and they shut down 3 months ago, or they're full. So the vision of this website is it's free to anyone to use. We'll be marketing it a lot this summer, and I'll tell you about that in a second. But what it is, it's a website, and we made a decision tree. We spent 2 years researching all of this, and we brought in Washington State's College of Nursing interns to help us. We researched all the resources in Spokane. What can we list on this? It's local, it's what our people can find in their own hometown. There are national listings on this site. Then we looked at other asset maps, which is essentially that's what this is bringing in all the information. Why aren't people using them? What are the barriers? So how do you navigate through trying to find the information you need in a simple manner to get to the information that you need now, not in 2 days when you finally get through the end of the website. So, and through this whole process, our interns helped us do resources. They helped us research the asset maps. And then we also talked about the barriers. The biggest barrier is insurance. So our decision tree, you go in there and you say you're 18 or under, choose that, because there's a big difference in treatments or resources. Then you'll go in and say, what do you want to be treated in? Is it opiates? Is it alcohol? Next one is, what insurance? I don't have it. I'm private. I'm Medicaid. And then submit. And then comes the list with the map. And we put the map intentionally so people can see for bus routes or anything like that. The resources that are near them, that are relevant to them, that they can get treatment without getting. I found the best thing for my son to find out they won't take my private insurance. So, all of these treatments are super expensive. And some of them are just prevention. I'm thinking my nephew's getting a little crazy here. I want to learn what are signs of prevention. You can go on to those resources too. So it has all of those categories, but we tried to make it really simple. So a big target for the foundation is always sustainability. I don't want to put this up and in a year not have it, or not have it current. So we will always be updating the website. We will always be looking at finding resources and research to keep it current and relevant to what our community needs. And as I mentioned earlier, we wanted a template. We want to be able to have, this is how you put it together. Now we'll go to the outer parts of Spokane that really don't get this lecture, and we can just help them plug in. We can give them if they need the resources to research, we find those resources for them, telehealth, whatever they need. So we're trying to really start here, be the people that have that, and people come to Spokane and say, how do you do this? And we can help them too. Next slide, please. So Narcan training. This one came about right before COVID went full down lockdown. So what happened, the reason we even came into this is Washington State had a mandate for all schools. I believe the population is over 2,000. You had to have Narcan in your school. I applaud Washington State for this. We're one of 7 out of the states that are saying we need Narcan. So thank you, Washington State, that be aware of that issue. But as a former educator, I'm looking at this realizing no one's training anyone. So now I have Narcan and don't know how to use it. So I knew the foundation didn't have the information, but because we worked with Wazoo, we connected with the School of Pharmacy and Nicole Roden. She is our expert trainer. She's in pharmacy. She studied it. A very, very intelligent woman who's very concise. And she does everything from what is Narcan, what it does to your body, how do you recognize an overdose? You can't. If someone sees this and you give them Narcan, you're fine. It's not going to hurt them. But she has the medical way to help you, explain that. And then she'll go through step by step what you do first. Call 911. You get the person on the floor, lay them correctly. Then how you administer Narcan, what you do waiting for the medics. And that's a good, almost an hour presentation. I made it sound very simple, but she's very, very thorough on that. There's 3 different types of Narcan. I was going to bring one today, but I ended up giving it to someone who needed it. So here we go. The nasal spray, it's almost like an aspirin or something. And then there's another one that's just a stronger nasal spray. And then there's the injection. And the most common in schools is the first one, the nasal spray. The first year that Narcan came into schools, it was provided no cost to the schools, 2 doses for free. We came into a big crisis last year because they all expired and no one can get them. I mean, they didn't know where to go. So last year, the foundation was being called often, where do we get them? We just bought them. If this isn't legal, no. But we were just handing them out because we couldn't stomach having a school not have Narcan. But the issue now is we need more than 2 Narcans in a high school for multiple, 2 reasons really. But 1, fentanyl is stronger than ever. So 2 doses does not provide you. You need 3 or 4, sometimes 5. If you have a big school, 1 location of Narcan is not going to, if I'm in the auxiliary building and my Narcan's in the main office, it's not going to work. So that is what we're trying to work with on with different programs. Is how can we get Narcan so the schools, when they need to replace because it's expired or because they've used it, what do they do and where do they go? Where's that hub? And we're working with pharmacies. We've been working with different groups of nonprofit and organizations, the health district, all of those, trying to find how schools should get a replacement Narcan without paying for it. So we're doing that. Also, the whole protocol of Narcan. So we've trained people, but what's the protocol, especially in schools? We had worked with ESG 101. They made a huge, I mean, it's a booklet this thick of what the protocol is. And that sounds daunting, but we want to be safe. So where do you store it? Does your staff know where it's stored? Who else is trained on it? Again, on the actual Narcan that you're going to administer, you have a cheat sheet. Put it on there. Don't think everyone's going to remember from a training 6 months ago. And what you do when you've used it or it's expired, but also all the forms you need to fill out after you've administered it. You know, if you're the lead person, if you didn't administrate it, that person needs to fill out a form, a report. And how do you support someone who just revives someone? Hopefully, sometimes it doesn't work. what happened, what, did that, what support do you need, what support do the students need after witnessing something like that? So the protocol in the school setting and as we move forward into business settings or other trainings. And also for the family. You can't just send a little, whether it's a colleague or a kid home and say, have a great day, you had Narcan. You need to have a packet ready for these folks and have them ready to go home if they choose and need treatment, they have some resources to find. And also what the expectations to re-enter. So there's some boundaries and that's really what they need and want. So it's a matter of always keeping everything updated, giving brochures to the families. Something the foundation does very quietly is say a kiddo decides they want therapy, but they can't afford it, it's expensive. We get contacted behind the door, we give a grant to that place, and then they can give the resources to that person. Okay, next slide, please.
And I know, so you're really focusing on the high schools for the Narcan
And middle schools?
and middle schools at this point in time, because we were seeing it's pervasive across the entire community.
Ideally, thank you for asking that. Ideally, we'd like it in every school. Because preschoolers have died of this, 2-year-olds have died of it, but also because middle school or elementary could be their parents because they were addicted to painkillers or siblings. So we should, then they have been kids that have come in with some issues of, and fortunately they caught it and no one died, that we wouldn't, but right now the mandates are high school only. Most of the districts have been really proactive saying we want it in middle school. But that's come a long ways. The first, when we started this, I had parents or schools saying we don't have it at our school. This year we are doing the training with school nurses statewide. And anyone can come, anyone can attend that. It's not just nurses.
Okay.
But
Because now I think that's, just, interesting for me to know that it hasn't really been in the schools yet, because it is something that is happening there. I mean, we know it in our jail, we have, Minister Narcan a lot. I think our officers, our deputies, they haven't, to have, when they go to, a situation. I was just talking to the health district and even at Camp Hope, I mean, there is a lot of Narcan that is there ready and available as needed. So I'm thankful for you to be bringing it into the schools to help, because it is something that's happening and we can't just ignore it.
right.
So,
And I've heard folks say, well, it's a Band-Aid. And I said, well, it's a good Band-Aid if you're saving lives. I mean, yes, there's other issues we have to address, but I'd rather save someone and then figure out the rest than say, no, that was a Band-Aid. In fact, we didn't lose this. And our goal is and we are doing this on the east side or west side, is start training communities, doing community training so they know and comfortable. And I would love to get the funding where if you come to the training, we give you the Narcan help. That's really how, and that helps remove that stigma. I didn't realize till a year into this or so that what if we've met Narcan has. We can say it's free, hey, go get it. Any of us can go get it. But people, oh, I don't need that. They're embarrassed because that sounds like you might have an issue. Thank you for those questions. So on the bottom of the triangle, that is really exciting. We started last November. It's been in my head for a bit. And but I knew I couldn't do it by myself. And what I've learned over the years of fighting fentanyl is we are all trying, but we're not succeeding very well. And we finally have learned that people are at the point of saying, uncle, let's band together. And that's what saved this Spokane Alliance for Fentanyl Education. Our first event was the Spring Summit. And our goal for that was to bring our community leaders from all sectors. We had faith-based government, law enforcement, education, nonprofit, businesses, anything you can think of. We brought them in, and our goal was to educate them and help them become aware. Just because you're a leader doesn't mean you have to know all of it about fentanyl. And we wanted everyone to have a solid base so we could attack this crisis unified. And brought in two fabulous speakers. The board of SAFE members is amazing. We have every sector, not every, but almost every sector on the board represented. And so the foundation is the fiscal agent. We partnered with the DEA. They provide a plethora of information. If you guys are looking for something on fentanyl or opiates or drugs, their website's phenomenal. And we will be getting that up on all of ours work too. So SAFE will have their information as well. But it's just really important to get this out. Losing race was hard for our family. It's still hard. There's days I still can look at my brother and see tears in his eyes, which makes me sad, or my parents. But it's not unique, unfortunately. You know, and so we need to do something. And this group, this group of SAFE board members get that. So the SAFE Summit, we came in and really brought in what was fentanyl, what's it about? And you can go to the next slide. We started in November. Here's the idea. This is what we want. We all had to marinate, get our own head wrapped around it. And by May, we had 175 people at the Grand Hotel educating our leaders. We broke out in sessions on that. We wanted to hear what's going on in your industry regarding fentanyl. Are you guys discussing it? Is there anything? Went on through all of that. We talked about, our speaker was Derek Maltz, a former DEA agent, and we asked him to be tame, but true. And he got people's attention. It is a killer. DEA has changed their wording that it is no longer saying just a fentanyl overdose, it's a fentanyl poisoning. They still use overdose because there is that, but you folks need to realize fentanyl has a huge stigma too. It's not just someone on the streets or someone who is a drug user. It's laced into everything, into Adderall, into Xanax, into Percocet, and you can't tell the difference. There was a young person that died this year in Spokane, vaping. It was laced in there, whatever he had at that time. I think it was pretty big. It is everywhere, and we have to be aware of that and accept that and address it. It's not going away. So, and you know, talk to your students like college age, because you think they're going good, but you go to college, they all share Adderall, or they'll all share, I have anxiety, but this will calm me down, thinking they're giving their doctor's prescription drug, but it isn't. And so that's what we really need to educate youth, but also parents. A new uptick with fentanyl is also seniors. They think they're saving money by ordering money online, and they're dying because it's laced. Statistics, 4 out of 10 pills laced will kill you. So it's a high number. Man-made drug, so it's very, very inconsistent. We could cut up one pill 4 ways and 3 of us could die, 1 could live, vice versa, because it isn't consistent, it isn't regulated. So that is what we really have to focus on. SAFE wanted to get the summit going, and we had great response. Not only did we have questions, we got back and wrote down everyone's comments and targeted what they needed and wanted. And now we're moving into phase 2. So next slide shows our board members. I was bragging about our board members, and I know that's kind of small, but this shows you the involvement. These people are crazy busy, and they work their tails off to make this event happen. And now they're doing it again. One of the things at this SAFE Summit, we asked for volunteers. I thought we'd get 10, 15. We have 60 volunteers in queue. People are getting it. And I know we can get more. So our next event is, there's some soft openings, but our big event will be the fall summit. We can go to the next slide. But what we did is from those questions, this is Reader's Digest version. This is what came from the summit. We had, everyone wants, you know, we asked, what do you want? What needs to be done? Educate, awareness. And what happens, everyone turns to youth. I think from our summit, people realized it's not just youth. The families have to hear it, the businesses. We're looking at doing like a lunch and learn where we come in and do a Narcan, like do box lunch, Narcan training. Do you know what OD looks like? If you're having a party, the risk of having kids in your house and someone bringing something not intentionally and everything, what do? Just getting people on top of their game. We're focusing on the fall event, and then the government, what we heard over, and it was positive. People weren't being negative, but they want law enforcement. One of the things is, what are the consequences? And are they getting the support, law enforcement getting the support they need for this crisis? The other is treatment. We don't have enough beds in our county. We don't have enough tools to help people find beds. That's why we started the Addiction Help Finder. And we know government's a big issue. So as a team of board members, this year will be a bunch of roundtables, really honing in for our ask to make things roll. But again, hearing what our community has to say. Next slide is really a more detailed, and not to focus too much on that, but our first year will be a lot of event-based programs. And this is coming from evidence-based program research, from just working in the community. We need to build the community's trust, we being safe. They need to know if we come to them, we're invested in them. We're not a one and done program. We're going to grow with them until, you know, they don't need us, but that won't, unfortunately. So we're going to start this year, the programs are evidence-based. Like an example, we'd go into the high school 3 times this year and get them wanting to hear, bring in someone local that they all think is amazing, or do a dodgeball tournament, whatever it is, to engage them. They need to see the safe team as a group of people they can trust and will be there. We're not coming in and saying that was bad, not going to work. But we are going to teach them and empower them to learn why they should be smarter about what pills they take and ingest, what they do at a party. If a friend is ODing, what do they do so they're not scarred the rest of their life because they watched their best friend die. So we want to do that. We want to get down to the elementary, when we're going to get into the parents. Parents are hard because of the stigma. They're embarrassed to go learn about it. And we want to, through our fall event, turn that attitude around. We want them to come in and, you know, say, hey, did you hear about that? And talk, and not, it's a healthy conversation, not a conversation of embarrassment. Or I shouldn't say this because then they think I know them a lot and that must mean my kid's doing it. It's not healthy. So this drug is man-made. It comes from Mexico. Honestly, if you want all the details, I would suggest you talk to DEA, but they are the experts. That's in everything we say on our board. All of us say it from their expertise. We're looking right now for a medical expert to be on our board that focuses just on fentanyl. We work with Wazoo and they've helped us a lot, but we really, Dr. V was the one that suggested that, and I think that's a great suggestion.
I think she's listening today.
Yeah.
So.
Oh, good. So we have to address this, and that is every time we do an event, we are coming in with true facts to help people be aware of it. I could go on all day about the dangers stuff and what fentanyl is, but what we're doing and what we'll go into. If you want more, I can take more time, but I'm really short on time, and I wanted you guys to have a clear understanding of how we're trying to attack and fight this, and we're trying to get our entire community to do so and be united together and not play the blame game. Well, they're not doing their job or anything. It's beyond that. We have the enforcement doing their job. We have to cut down the demand. And the way we do that is educating everyone and working together. So.
Well, and I appreciate, and I should say, you're talking about Dr. Velasquez, I'm sorry, from the health district, so who's great. And we have Dr. Zing, our medical examiners on, because she's going to be speaking right after you, giving us an update on the medical examiner. But I know I saw her on earlier, listening now, because I think, she's seeing it on her side as well.
Yeah.
And I guess one of the things that, since Narcan is so readily available, and I'm happy because we're not seeing the deaths from it, but it's also, I feel like it's almost covering up the problem that people aren't then seeing how much of this is really happening. So I don't know if there's any way to quantify how many times we're using Narcan in these different areas to know how big of a problem. I mean, because my gut is telling me it's a crisis.
Yeah.
When I'm talking to firemen and they're saying that they're administering it, when someone does overdose and they're, come back, and if they're coming from the hospital, then they're getting a couple Narcan doses themselves for their family, for, if something happens. And so it feels like it's kind of like you said, it's a bandage, and we need to, but we're not seeing what the real problem is to know.
I totally agree. We have asked, we were just in the middle of a program to track that, like the schools they track everything, they have great data just for you. But then COVID broke out, so then kids were in school, hybrid, you don't have the statistics, but we were just saying, how many overdoses do you have in a day? How many? And so we had that ready to implement, and we're hoping that we can do that. But under any of these programs, and safe to do it easily with the right people, just have a tracking system. You would think our first responders would have a tracking, how many they go, they have to keep track of that. But sometimes that's not accurate either, because it could be 5 doses for one person and you can't read that, there were 5 ODs that day, so it wouldn't be that hard to do. But that is a really good point, because we're missing the true data, and that's what we've noticed. We say that in our trainings too, that this is a high number, but it's much higher. And it's not going the other way, unfortunately, yet.
And last year I had attended the sheriff's awards banquet that he had for the deputies last year out of Northern Quest, and most of the awards, they were plaques, and they were given to deputies who had saved people's lives. There's the majority of the individuals that were recognized, and well over 50% of them it was a story of a deputy entering a home, someone was there, not moving, they had overdosed, and it wasn't 1 dose of Narcan, it was 2 or 3 doses that needed to be administered and then as the person was reading the narrative, it was like after that second or the third, the person would just stand up and start walking around. I mean, someone that was laying there, they said that appeared to almost be a lifeless body, that second or third dose, and the person would just stand up. I mean, it's incredible. But again, it's like, I mean, that's 2 or 3 doses. That doesn't mean one instance of an overdose, or I mean, that doesn't mean 2 or 3 instances of an overdose. It's 1 overdose, but it takes multiple doses of the Narcan.
And that's why it is important to have training, and we're not the only ones that do training, but the true training of Narcan, because that is a very common response, because it's an adrenaline, the Narcan does it. So you have to know when you're training what might happen and be aware. Hopefully, since you called 911 first, before you did on that, they should be there pretty quick. But that happens a lot in the ambulance and whatnot, so that doesn't surprise me.
What's the shelf life of a dose of Narcan? I mean, it's 1 year. Okay.
Now, and that's a whole other project going behind the scenes is we can't throw all those Narcan. I mean, think about it. How many schools in Spokane County as Narcan, they're expiring. Please don't throw them away. I'll take them personally, say they're from me, and go to the homeless shelter, because they really, if you talk to the medical field, and I don't want to say they're endorsing this, it's me saying this, but it's like aspirin, you can make it another month or two and you're fine. So why not, instead of just throwing it away, find a way to disperse it into a high need community. Yeah. And I know.
Yeah, so Bill, I don't know if you came in a little late. I
I
think.
went
you were
over across over Public Works.
Oh, sorry. Thank you for
We're not
joining
there.
us.
Really?
So I want to give you an opportunity to speak, and then I know Dr. Zing is on, so I want to give her. an
So I
opportunity.
totally support what Marcia said. I came at this from the law enforcement side. And it was real clear to me when I served as the U.S. Attorney that we've got a hugely fast growing crisis in Eastern Washington and across the country with the influx of illicit fentanyl coming in. Now, on top of that, you've got people buying counterfeit pharmaceuticals over the internet that aren't buying it on the street. And turns out that these are oftentimes fentanyl laced pills. We could go into detail about why all that occurs, but we've got a huge crisis that is growing. And as Marcia gave you some of the statistics, and DEA has vast information about it, it's going to get a lot worse. And there isn't any plateau in the horizon in terms of the demand for fentanyl. Law enforcement is doing absolutely, federal, state, and local, tribal law enforcement, doing everything they absolutely can to attack the supply side coming in. This really is a community obligation to address the demand side. How do we raise awareness? And that's the safe part of this. How do we raise awareness so that you try and lift this stigma that's very real, and Marcia talks about, so that people get the information so that they can make healthy decisions for themselves. But in the near term, this crisis is gonna get much worse before it gets better. We have got to address this as a community.
Thank you. And Dr. Zing, I see you. I know you're going to be probably giving us a little bit of an update in your presentation. Hi.
Hi, good morning, everyone. Yes, I want to add my voice to this. This is definitely a huge crisis. We have seen from 2019 to 2020, a 285% increase in fatal overdoses. Not all of those are fentanyl, but a lot of them are fentanyl alone or fentanyl mixed with other things. And I think, yeah, for sure, people who are buying illicit pills, whether they think they're buying illicit Adderall or they think they're buying illicit Xanax or something, a lot of those drugs, or let's say now all of them, are mixed with or cut with fentanyl and also fentanyl analogs. So there are a lot of other drugs now that are based on fentanyl, but even more powerful. The makers of these illicit fentanyls are very creative. They stay ahead of our testing a lot of the time. So sometimes we can't even detect those, but there are some other drugs also being cut into the supply. And I totally agree, the stigma needs to be decreased. There are two, from what we've seen, two sort of general populations. One, the people who think they're getting something else and are inadvertently getting fentanyl, and then the population that are deliberately buying fentanyl. And it sounds like for your foundation, you're more targeting people who think they're buying something else. I might be misinterpreting that, but if that's the case, I wonder if you've thought about also handing out fentanyl test strips so that people who think they're buying Adderall or think they're buying Xanax or something else can just quick test their drugs or go to a test center and have them tested to make sure that they're not containing fentanyl. That would be one thing. And then another thing that I've seen a lot in our cases is that people are using in a group and everybody in the group is using at the same time. So I'm not sure if there can be some education, especially amongst the students, about if you're using in a group, have not a designated driver, obviously, but along the same ideas, someone who will stay sober and keep an eye on things so that if somebody starts going out, they can call 911 and administer the Narcan, because if everybody is unconscious, nobody's going to be able to sound the alarm and give the Narcan. So my 2 cents, but I think it's great. I think it's wonderful that there's going to be kind of a broad coalition of people working on this, because it is such a multifactorial problem, and it's going to require everybody to pitch in and work on it.
Thank you. You guys have any other questions? Commissioners? Any other comments? I guess I just want to say thank you, because I think it is huge. And like I said, in going around and talking to people and knowing how readily available Narcan is, I think it's in some ways masking the problem for us as leaders to know what the true problem is. And I think, I know from law enforcement side that, there's more and more fentanyl coming in and coming across, but I think, through you and talking with Jeff and stuff, even talking about how seniors are using, going online and buying prescription drugs to try to get it cheaper. And it's getting laced with this. And it's like, that's the thing that's just so, it isn't any one sector of society or age group or any of that. It's across the board. And how do we get that message out?
And that's why we were looking at the event base. It's the biggest bang for our buck, and we can connect quicker and then hone in and really make things more specific to the groups we're working with. At least they know we care, we're working with them, and get that word out, because it's like, it doesn't discriminate.
When does your Addiction Help Finder website go live? Because that's something we can probably push out on our
I love
county
that.
social media.
So
Just
our first
folks know about
intro will be August 24th, because we're doing our statewide Narcan training that day. And then after that, we'll go into all the schools, businesses, whatnot. And we're very open. It's, free. Anyone can put on any resource we can. If we miss one, we would love that input, and then we have a whole glossary on that page or on that website of what we're doing. We're also doing stories of hope on that. When we did roundtables on just creating that, we brought in all sectors again, just saying, what if you were looking for a resource? What do you want? What would you need? So we heard it from someone who's an addict, someone who's in recovery, to a mom, to a grandma. So we could really be thorough on that. So there's other resources on there, but yeah, and I can send that date too, and the link too, so everyone have.
if you get us the date, we'll be sure to get it to our PIO, and he can push it out on our social media channels, just so.
I would love
Well,
that.
And it seems like it really needs to become just like CPR training, that you're getting Narcan training along with, figuring out how to get it into that mainstream training for everyone that needs it.
Yeah, we've been asked to, we're booking up on the training. So it started with the schools for the reason I told you, and ESD 101, this is the 3rd year they've come back. So they have to retrain every year, and we give them credit hours. But then we just did, we had Spokane Behavioral Recovery and Treatment Center. I have a business company that's asked it, and we're doing it. My brother's a developer, so we're doing it to all the management companies. It's endless.
Right.
That you want to make sure you have the right information for them, the packets, so they're ready to go and it's successful, as opposed to spending 2 hours of training. And then we also a lot of times provide trainer kits. So it's a fake Narcan dispenser. So you could go, if you learn how to do it, then you can go back to your workforce and show everyone, so more people know.
Just wanted to say, sorry for your loss, and thank you for your passion.
Appreciate it.
How old was Race?
Race was 26. And yeah, he and his brother and my 4 kids were inseparable. He always had 6 or none, but yeah, and he had a great sense of humor. It's very, very kind, sensitive, not what you would think of someone who would die of fentanyl, but that's the case now. That is the norm. That's what's so sad. I forgot to put my slides. the faces of fentanyl when I was back in DC for a DEA conference. They have the faces of fentanyl. And you can't look at that without crying. I mean, when you see how many faces, 26, 16, 45. And the newest OD, fentanyl OD is the age band is 14 to 54.
Yeah. And I think, Dr. Zing, I mean, you know what you're seeing in the medical examiners with the age group. And I know when I came and visited with you, we were just at that time, I think there was the deaths that were had happened over in Coeur d'Alene as well. You know, so it's the region.
Right, it is the entire region. I mean, we're covering most of Eastern Washington now, and we see, again, all strata of society, all ages from, you know, early teens or preteens up to 60s, 70s-year-old people. And I think it used to be easy to say, oh, you know, sort of stereotype in your mind who was a heroin user, who was a methamphetamine user, but anymore, any of those drugs can be seen anywhere. So yeah, it's just really lowering the stigma about talking about it and opening up conversations about treatment and prevention, I think are so crucial to avoiding addiction or avoiding use and avoiding death for sure.
Thank you. Well, thank you very much. Appreciate you coming. I know we're a little bit over.
Thank you so much.
You know, I think it was, you know, we know that you put in for requests or ARP dollars. And so I just felt it was important for us to hear directly from you as to, you know, what the needs were and just what you're doing for our community. So thank you, because
Appreciate
truly
the
what you're
opportunity.
doing is huge for our community.
I hope so. We need to stop this. I'm tired. It's hard when you meet 6 parents at a table and they hear your story over.
Yeah.
Yeah.
Well, and I see Colin is here from the spokesman. So hopefully Colin got to hear a lot as well.
He's focused.
And so no, I really felt like this was going to be a great way for us to learn and for our community to learn because they watch the meetings. So thank you very much.
Appreciate it.
Appreciate everything you're doing.
All right. Thank you, you guys.
And yes, Marcia will have to reconnect at some point.
I know, I'm around all summer, so I would love to.
Okay, yeah, that'd be great.
You the,
That's a good
just
show.
in Spokane or?
Yeah, yeah. I'll reach out soon. Thank you.
I would love that.
Okay, thank you, Bill.
Yeah.
Appreciate it.
Great to see you.
Okay, that's going to take us to our next item today is Dr. Vina Zing with the medical examiner to give us her annual report, I think is what we're going to get to see, which I think some of this topic will be in there.
Yes, annual report and some updates on what we're up to here. So I just wanted to start, actually, there was a slide. Oh, that is the annual report. I have just a quick summary slide of what's happening here in the office, just sort of touching on or related to what has just been talked about. We are seeing continuing rising caseloads. So even from last year to this year, we've seen a 10% increase in cases that are being reported to the office. And all of those, of course, require some level of investigation. 29% increase in cases that are falling under our jurisdiction and a 31% increase in cases requiring an autopsy. That's just in Spokane County. For an in-depth look at the numbers, we can look at the annual report. So this year we're trialing these are last year's numbers, so 2021 numbers, but we're trialing a new format for the annual report in the hopes of making this information a little bit easier to kind of look at, see quickly what the trends are and get a good overview of what we're seeing. But notable events from last year, I think you guys have a copy of the annual report. We have some bound copies here at the office that I can send down if anybody wants more of a fancy version. But as you'll see when you're looking through it, we did have the heat dome event. So this time last year, we were suffering through some very high temperatures. and 20 people died in that of heat exposure during that event. That is more than all of the several last 8 years put together, the 8 previous years put together. So that was a pretty notable spike in deaths from environmental exposure. Of interest, the majority of those people actually were in their homes, and their homes, though, did not have adequate cooling systems. So I think there's in a lot of places around the country, it's mostly unsheltered individuals who are dying during exposure events. So kudos to the county, Spokane County, for providing cooling centers and other ways for the unsheltered people to get out of the elements. Unfortunately, there is some inadequate cooling in the housing that where people did unfortunately succumb to the heat. And then the other thing, as I touched on before, is the marked increase in overdose deaths. So again, the 285% increase from in 2021 over 2020. And just of interest, from 2019 to 2020, it was about a 46% increase in overdose deaths, which we at that time were like, oh my gosh, that's a huge increase. We didn't know what was to come. So it does not seem to be tapering off. Fentanyl, from my reading of the literature, has really flooded the market. So as we touched on before, a lot of people that were using heroin before, it's a lot easier and cheaper now to get fentanyl. It's easier to use apparently also. So a lot of those users are switching to fentanyl. And then there's the whole problem of the contamination of the illicit pill market. So people who are, again, thinking that they're purchasing off of Snapchat or Instagram or on the street, they think they're getting Xanax or oxycodone or something else, but they're getting that mixed with fentanyl, or they might just be getting pure fentanyl. So again, continuing to see a whole bunch of increases there. So the annual report.
Dr. Singh, while you're there, so I guess just to clarify for me, just I mean, I've heard different things. You're saying like a whole fentanyl pill, but I've heard like it just takes a little grain of fentanyl on a pill could be enough to kill somebody. Versus,
go ahead.
Versus like, and I guess I'm hearing that they're trying to lace it so that way it makes it addictive for people. Is that correct?
So yeah, I think there's probably a variety of reasons why it's being laced. One, it does sort of exaggerate the effect of whatever people are buying. So it makes it stronger and therefore more desirable, right? For people who are trying to get high by buying these pills. The other thing is it's very cheap and easy to get now. So where people previously were using something else to cut their pills, they can easily get fentanyl and mix that in. I think the problem is not, as the previous speaker alluded to, it's because they're not being made pharmaceutically, they're being mixed by hand typically. And so the mixing is very uneven. So people, let's say you make, actually, I'm not quite sure the mechanics of it, but let's say you're making a pan of pills that you're or a pan of substance that you're going to cut into pills. If you're just sort of mixing it in roughly and not in a pharmaceutical manner with that kind of level of precision, it's going to be that part of the pan doesn't have any fentanyl and part of it has a lot of fentanyl. Fentanyl is a very powerful opiate drug. It's more powerful even than morphine, more than most of the heroin that's out there, or that it's sold as heroin. So it doesn't take very much to kill you. That's true. But it really, the issue is the unpredictability of the supply. So there are people who are buying a bag of 30 pills, they use 5, 6, 7, 10, and they're totally fine. The 11th one, because it contains a big chunk of fentanyl, is going to be the one that kills them. And if they get that pill first, obviously that's going to be it for them. So did that answer your question?
Yes. No, thank you.
So yes, that it is a big problem. And again, we're seeing kind of two distinct, I guess, populations. One is the people who think they're getting something else, and that includes also people who have been recently incarcerated. They're getting out, they're expecting the drug supply to be similar to when they went in 3 or 4 or 5 years ago. It's an entirely different landscape now. And then also people, chronic pain patients, because of the crackdown on oxycodone and other pain medications, they're turning to buying, and this is where you see some of the older population, they're turning to buying their pain medication or supplementing their pain medication by buying online or from a friend or something else. And a lot of those drugs, that supply is contaminated with fentanyl. So, so yeah, it's a huge problem, and I hope that there are more foundations coming out onto the scene that are going to focus on different aspects of the using population for sure.
Great, thank you.
So yeah, that first slide is just basically what I was telling you, that we're the case numbers are still going up. Next slide is the annual report, the link to that. So it's on our website also. This is the link, but again, if you're looking at the annual report, let me know how you think the ease of use is, and if there are other things that we could do, kind of tweak it to make it more usable for people to get information quickly. Next slide. I also wanted to just update you that we did pass our annual inspection. There's an interim inspection every year that involves uploading all of our information for the year, and the National Association of Medical Examiners looks at it, makes sure that we haven't diminished our service or the quality of our work. And then we did successfully pass this year's interim requirement, so we are still accredited. And the next physical inspection, so we'll be doing these annually. Our next physical inspection will be 2024, when the inspectors will come to the office, look at our entire facility, go through, audit a segment of our reports of various kinds. And I don't anticipate any problems, but we are always working hard to kind of keep our information up to date, keep our procedures and processes up to date. So exciting news. Next slide. You might remember that last time I joined you, we had a discussion on strategic planning for our office and whether we should move in the direction of a regional center of excellence. I'm pleased to tell you that our plan is moving full speed ahead because our moving into this coincided with a severe shortage or worsening shortage of forensic pathologists in the area, or in the whole state, basically. So we have added contracts with Benton, Franklin, Walla Walla, Whitman, and Grant counties, and we have also taken some cases from Adams County. They use a contract pathologist, as do Grant and Whitman, but their pathologist has been ill these past couple of weeks, and so we've taken some cases for them. So you can see from the map that we went from what is on the left, that was our coverage area before. Now we are really covering most of Eastern Washington and Northern Idaho. So we expanded in mid-April-ish, and we've gotten 50 autopsy cases from the counties that we previously contracted with, 22 from our new counties, and then 200 from Spokane in that time. So just about a quarter of our cases right now are coming from referral counties, and that's pretty much around what we were projecting. So, so that's good. Next slide. When I was here last, we also talked about some operational changes. So I just wanted to quickly update you on those in terms of our tissue procurement room and renting that out to community agencies. We have executed a contract or signed a contract with SiteLife. So big kudos to Matt Koza for that. Our other contracts are still under negotiation, but I think we're pretty close to getting those signed with the 2 tissue procurement agencies, Life Center and LifeNet. So I hope that by the fall, we'll have that room totally up and running and in use as needed for these procurement agencies. I had mentioned, I think, that we were looking to upgrade our case management system. The State Forensic Investigations Council has paid for the startup costs, and they will be paying for the annual ongoing costs for that. So that's really great. We're still kind of learning the ins and outs of the system, but so far it looks to be a lot more comprehensive and user-friendly. It'll enable us to pull data a lot more easily and share it around to different groups that are interested in it, different agencies. And it's also the system that's used by most of the jurisdictions in the state. So it has really facilitated our interactions with our contract counties, our new ones, and the old ones. And it'll make things go more smoothly once we get up and running with the tissue procurement agencies. It is web-based, so it allows investigators to upload information from the field. If they're going from scene to scene to scene, they can at least get us the preliminary information. And it's also, because it's web-based, better suited to continuity of operations. So as we're making our continuity of operations plans, in the event that our facility becomes inoperable, our old system could really only be used within our local drive. But this one, if we have to relocate to an alternate site or work from home for a time, we can still access our database. And as an additional benefit, it's allowed us to go mostly paperless. So we're saving trees and money with this new system. Next slide. We did also last time talk about hiring a fourth pathologist to give us the most flexibility in meeting the demands on our office. And I'm very happy to report to you that the pathologist who had expressed some interest did apply and has accepted our offer to be a deputy medical examiner here. Yay. So he'll be, he's just finished his training in Texas, actually. So he'll be coming to us from there. He's going to be starting August 1st. And in a time when offices around the state and across the country are really struggling to attract candidates, I really just feel blessed that we've been able to hire someone so quickly. We need him, you know, as we've taken on a lot of these other counties, it's been very busy here. So we're really eager to get him up and running and get him moving. So I also just in general wanted to shout out our region because we have been hired or been interviewing and now hired for our 7th medical legal death investigator position. And we are continuing to accept applications for our internship. And for both of those positions, we've had so many highly qualified applicants, not just from Washington State, but all over the country and overseas, actually. So this area is apparently very attractive to people from everywhere. So that's really been gratifying to see that. So we did hire our medical legal death investigator from Pennsylvania. She'll be relocating to the area to join us also August 1st. We graduated our first 2 college interns. They're both have expressed that they're going to medical school. One I know is actively applying this year, and they both expressed interest in becoming forensic pathologists. So hopefully they'll just be finishing their training when I need to retire. So I'm doing my best to find replacements. We do have 3 summer interns currently. One of them came all the way from Vermont to have this experience here. So again, just really great to see how excited people are all over the country to come here and experience Spokane County. Next slide. Sorry, I know I'm talking really fast, but we're a little bit behind, I know, so I'm just trying to get through all of the updates. I wanted to also just let you know that there's some exciting things on the horizon in terms of grants and updating the office. So this is a grant that you all had applied for on behalf of the office. We were awarded $588,000 and we've just signed the contract with the state. Shout out to Heather Arnold if she's here or someone from her office is here. She has really been invaluable in navigating all the grant paperwork. But we're intending to use this grant to replace some aging and malfunctioning equipment like our freezers and refrigerators, our dental x-ray machine, bone saws and scales. That's things that break down quickly or after heavy use. We're planning to purchase some teaching and training equipment. So a double-headed microscope so we can look at slides with students, medical students and interns. We're planning to purchase some training mannequins so we can do some more death investigation training for the region. We have several new coroner counties so the coroners and coroner investigators have expressed interest in some more hands-on training. So with the mannequins, we can stage scenes and walk them through investigation of various types of scenes. And something that I'm really excited about and also sort of dovetails with the previous speaker is we're planning to purchase some tabletop analyzers that will basically we'll use for real-time toxicology testing. So currently the wait times for the state lab to do toxicology testing can be 6 or 8 or more months. And that's a really long time for families to wait to find out what happened to their loved ones, for us to wait to sign out a case. So these analyzers would be a tool by which for certain cases, we would know the same day whether someone overdosed and what they overdosed on. But purchasing these machines is contingent on us being able to get the test kits. So the test kits are really what makes the whole system work, and they're not cheap. So we have applied for ARP funds actually for this purpose. So we are anxiously awaiting the word on whether we'll get funding for those test kits. And once we have secured funding, whether it's through ARP funds or by some other means, then we can move ahead with purchasing these tabletop analyzers.
So Dr. Zing, once that funding were to become available, how long would it take to actually start doing this yourself? Just because I've actually honestly been contacted recently by a family who their friend overdosed, and they're just devastated, and it's going to be 6 months. And so how do we, if we get this in, how soon can you start to, and would you take care of some of your backlog with it, or would you just be going forward with it?
So we have to secure the machines. I've already been in preliminary talks with the manufacturer of the machines. They have some set aside for us. So it would be an issue of once the contract is signed with the state, then getting the purchasing agreement in place and then purchasing them. So it would still be another a couple or few months before we get the machines and the test kits. The test kits will be coming from the same manufacturer, and we can get them all at the same time once we've secured the funding. But the other piece of it is that these test kits only test a certain kind of range of drugs. And those are the common illicit drugs, including the fentanyls and the fentanyl analogs. So they'll be most useful for that population. And if the suspicion is that someone overdosed on those or oxycodone, heroin, kind of the more common illicit drugs, those are the people that we would be able to know right away what happened to them. Also for screening drivers, for example, or other people, we'll be able to screen those for common illicit drugs. Unfortunately, sometimes a wait is because there are other drugs involved. So someone may be overdosed on their blood pressure medications or their antidepressant medications or something like that. That still unfortunately will require using the regular lab and may require a long wait.
Okay.
So Dr. Saint, so if I understand you correctly, if you do the tabletop analysis and that comes back, inconclusive, or you don't find something that it screens for, you would probably still send that sample out and to
Exactly right.
a third party to analyze.
Exactly right. Yeah. So this test, if it's positive and the scene findings and the autopsy findings fit what it's positive for, then those cases we can be pretty confident that that's what's happening. But if it, for example, it looks like an overdose, or we have information that someone said they were going to commit suicide or something, even if this test is negative, there may still be other drugs involved that we just can't detect through this particular test. So yes, we would absolutely, in all cases, send the specimens to the regular lab to chase down what other drugs might be involved.
Okay.
And I guess the other thing is, in our testing, one of the questions I had too was, does this affect, with law enforcement? Is this admissible in court if they need to use it for that or something? I don't know. Versus having it go through the Washington State Patrol's testing lab.
Right, so yeah, right, that's another thing. So this test would be, this gives us information for signing the death certificate, but in terms of court, we would still be sending them to the lab for confirmation, and the lab's result would be what would be admissible in court. That's right now. So the landscape again is changing. There are a lot of medical examiner offices using this machinery and publishing literature on this. I expect that down the road, this will be admissible in court, but it's not currently. So yes, we will still be sending all of the cases to the lab. Just that having this machine will enable us to get the death certificate out, let the family know, and then for overdose surveillance. So let's say that we're trying to figure out where are the clusters occurring. We'll be able to say, well, we've just gotten, 5 overdoses from the valley, or we've just gotten 6 overdoses from Airway Heights or something like that, so that law enforcement, fire, everybody can kind of be on the same page as to there might be a new drug or a new supplier or something happening in the marketplace that that we need to be aware of. And so this would enable us to detect that more quickly than waiting, for the 6 or 8 or 10 months. Because once that result comes back in many months, we've missed our opportunity to try to do some targeted interventions or targeted education or a press blast saying, if you're buying your drugs in this area, be careful, that type of thing.
Okay, thank you.
Other questions on the machines? Right, so the next slide, this is another request that you guys made on our behalf. And this is for community project funding. We received notification that we're eligible to apply for these funds. As I have learned, being eligible to apply does not necessarily mean we're going to get them. But again, with a lot of help from Heather Arnold, we have submitted an application to purchase a CT scanner for the office. And this is going to be another really exciting tool for the office as we get busier and busier and the pathologist shortage worsens. I don't think we can count always on finding a good candidate as quickly as we did this last round. So we need to be creative in finding ways that we can keep up with our caseload. And a CT scanner would be a great tool to augment pathologist and autopsy assistant staffing, and again, give us more flexibility in meeting the needs of Spokane County and also the region. And a CT scanner also would allow us to better accommodate family objections to autopsy, religious objections to autopsy. It would be a great teaching tool for medical students and residents. I've already talked with Inland Imaging, which is a big imaging group here in town. They're interested in maybe doing some joint activities for teaching of radiology residents, as well as the students that rotate through their office. And just as a side note, if we get funding in this cycle, this would be the first postmortem CT scan in the state. So that would be exciting to have that here in Spokane County. So anyway, as I understand it, doesn't mean we're necessarily going to get the funds. So if anyone has any pull in the office, this was submitted through Congresswoman Morris Rogers' office. So if anyone wants to reach out to that office with support for our application, feel free. And lastly,
Dr. Singh, on that,
Yeah.
did we, I don't remember doing a letter of support for that. So is it something we can still do, or you've already turned it in?
we have turned in the application. This one did not ask for letters of support, I don't think. But I don't think they would go amiss if we wanted to submit. And I don't know where they are in the timeline of selection, but I think, if you guys are willing to write a letter, I would certainly send it along, and it can only help, right? It can't hurt us. So.
Okay, thank you.
All right, and then the last slide I have is I wanted to let you know about some other exciting technology that I'm pursuing, or that we're pursuing for the office, and that is trying to get funding for forensic genetic genealogy testing. And this is advanced DNA technology. It's been used in a number of unresolved cases to work on cold cases or to identify unidentified decedents. And this, you might have heard of this technology for the Candy Rogers case, which was big in the news here locally. last fall. So this basically, we've got a backlog of unidentified decedents, and many of them couldn't be identified by traditional testing methods. Some of them have been waiting to be identified since the 50s and 60s. Some of the people on the list are potentially homicide victims, but since we don't know who they are, it hasn't been possible to develop leads for investigation. So we had originally applied for community project funding for this. This is where I learned that being eligible for application doesn't mean that we'll get it, because unfortunately we did not make the final list for funding through that mechanism. But we have partnered with Offram, which is the lab that did this testing for the Candy Rogers case. And we've applied to use ARP funds for this too. So I actually have 2 applications for ARP funds. But I'm very hopeful that this one will also be successful. Offram is really eager to do some work on these cases so that we can get these people identified, give their families some resolution, and also if there are homicide victims in that group to move towards investigation of those cases.
So one of
So
the questions I have on that is, so then that's going back and looking at past cases, correct?
correct.
Because in the future ones, we have the technology already for future ones, is that, or would we still be using this for future cases as well?
Well, so this is still not in kind of common use. So this is a new technology. I think part of the reason that we're excited about doing this is to kind of prove the concept that it can be used even in real time. I think that using this technology, there'll be a much smaller pool of unidentified people in the future because this is a technology that does a much more in-depth analysis of DNA, and then it also matches that DNA profile to genealogy databases where people have uploaded their own information, 23andMe and those kind of databases. So it goes a lot further than traditional methods in terms of identifying potential relatives of the deceased and then kind of narrowing things down from there. So as this becomes more mainstream and is more widely used, yes, it'll definitely diminish the number of, or it'll diminish everyone's backlog, and it'll prevent the backlog from forming because they'll be able to identify most people much more quickly than we have been in the past.
And do you know what our current backlog is?
In our office, we have just about 35 cases that are of unidentified people.
Okay.
And that's going back to even before this office was a medical examiner office. Some of those were from the coroner days, but we still have the cases hanging on.
Okay. Thank you.
Those are all the updates I have. Sorry for rushing through them all, but if anyone has any more questions for me or other questions for me.
No, I don't have any more questions. I kind of asked along the way, so thank you. But I just have to say thank you for, you're just doing a great job, and I'm glad that you are seen as the regional expert, and you're just continuing to make the office, that regional, the experts for our region, for everybody. So, thank you for that, because I think that's helpful to the other counties that don't have the ability to do that. Because as we know, it is, a lot of this is for the victims' families that we're trying to, and for law enforcement, trying to get that information quickly and for them. So
Right.
thank you.
Thank you for saying that. And I also just do want to say that the other counties, especially the new counties that we've taken on, are so grateful and appreciative of Spokane County providing this this service to them, that every time they call, they express that. So that's been really just kudos to the county, and kudos to you guys, the leadership for supporting that, because that's huge. We couldn't have done it without that.
So I'm trying to count on the little tiny map here. So is it 19 counties other than Spokane that
Yes.
you provide service? Okay.
Yes.
So Spokane and 19 additional counties.
Yes. Yes. We'll take
great.
over the world.
Yeah.
Well, thank you very much, and excited for your new employees to be coming on in August, and congratulations on getting that, because I know when we were going through the hiring process for you, there was all this concern that we would, hard to find people and doctors that are willing to do this. So, so congratulations on landing, another doctor for us.
Yes, thank you. I feel really blessed that we've been able to do that. So yeah, All right. All
Okay,
right. Thank you guys.
much.
Good morning.
Good morning. How are you doing?
Good. How are you guys?
Good. We just have to like wait just a moment until I have another commissioner back in the room.
Sounds good.
I didn't realize I was losing commissioners.
Ron, are you ready to help me out?
Yep.
Awesome.
Yeah, so if you've got. Let you make sure you got that pulled up.
Yeah, if we could start with the PowerPoint, perfect, and then we'll go into the other 2-page document, just the fair budget recap for this year. So that would be wonderful.
So how are you guys doing?
Good, we're getting busy. We're really excited. We have our job fair this Wednesday.
I've heard a lot about it,
Thank
so
you
that's
for the
exciting.
press release, good timing. We'll really know Wednesday, you know, with what kind of turnout we get and our desperation levels of getting enough workers for the
Yeah.
fair, so.
I know Doug's just recently been on the news as well, talking
Oh.
about.
Yes,
A little recruiting, yeah, a whole lot of recruiting.
and Doug's even,
Has it helped?
Well, we've had one person walk in the office following the news. So other than that, I'm hoping this week that we'll have some applicants come in. So I'm optimistic. I was really appreciative for the stations, including that component in their story, which
Yeah.
I tried to advocate for. So they were great.
No.
Both were pretty good at helping me really stress that we're still actively looking, and if you're over 18 and you like the outdoors, yeah, maybe we can solve this together.
Yeah.
well,
Yeah.
no, they could get a really good tan if they start now.
For sure, exactly.
I love it.
Yeah, so we're optimistic because we really would like to fill those. And yeah, that's what we do.
Okay, which is great. And then, Erin, how many people are you trying to get?
We would like to get over 200. We have about 100 returning applicants so far that have worked for us in the past, so that's really helpful. And something I'll touch on today is, I know Scott and Doug are aware of this, but we are facing some challenges with Geiger this year. Obviously, they're facing their own staffing challenges, but they are such an integral part of how we operate the fair. And to replace 40 to 60 Geiger workers with folks off the streets, it would be a huge undertaking. But Doug and I and Kurt have met, and you guys are trying to get some creative juices flowing, but they just don't have enough bodies to squeeze out for us.
We can get some bodies, we'd be thrilled to help. So we're
Dynamic.
trying to figure out what we might be able
I see Rex Farber's listing as well, so,
Mhm.
yeah, I know it's just, I mean, it's a workforce shortage in
Yeah.
every
Yeah.
occupation, every
Right.
area, so it's, yeah. It's just hard for all of us, so I'm hopeful that we will have great luck today with the job fair.
Yeah.
So, but
Well,
I've definitely been seeing it, so. around,
Yeah,
so
good,
that's
good. Yeah, great media coverage. We've done some paid advertising as well. Good morning.
Hello.
Hello, hello. And this is Bill Johnston, our finance person. for the fairgrounds.
Hello,
Hi, Bill. How are you doing?
pretty good.
Bill and I have seen each other a few times, so.
That's right.
Okay, well, we've got Commissioner Kern's back, so we will go ahead and let you start your presentation.
Wonderful. So today I am here to talk to you about our need for some investment and improvements in the Fair and Expo Center. It has been about 20 years since anything major has happened out there, and we're aging. Our staff does a fabulous job maintaining our facility, but there are things starting to happen that are beyond our control and bigger than us. So we'll go ahead and dive right into this presentation. Ron, if we could go to the next slide, please. So today we're gonna review existing conditions, background assessment, recommendations, and a request and action items. This is all pertaining to our failing HVAC system and our roof replacement for bays 2 and 3, which Don't be alarmed by the giant dollar signs we're about to show you. This HVAC system we're referring to, and we could advance the next slide, thank you. Provides heating and air conditioning for base 2 and 3. It is no longer functioning. Our roof structure over these two buildings actually leaks when it rains and snows. And we had some great rain events in June that reminded us during the Farm Chick show, we've got to get the buckets out. So our staff is great at jumping in and handling those situations, but the promoter and the vendors don't appreciate it when their items are getting wet in their booth, and now they have 5-gallon Home Depot buckets in there. And if you look at the photo there, you'll see base 2 and 3 are our two most southern buildings in our main expo complex. So they are used 200+ days a year. Next slide, please. They make up about 35,000 square feet of the nearly 150,000 square feet of exhibit space at the Fair and Expo. So they're very important to what we do. If you look in the photos here, there's a picture of the rooftop units. They're located in the cupola above bays 2 and 3. There are 2 units that serve bay 2 and 3 units that serve bay 3. Next slide, please. The units were installed in the mid-1990s and have served us well exceeding their lifespan. We brought in HVAC professionals last year to see if we could bring them back to life, and unfortunately, the parts are no longer available. We have worked with the County Facilities Department and Bernardo Wills to put together and evaluate a plan on how we would go about replacing these units. Next slide, please.
Are these units natural gas fired units, or are they just air conditioning units?
They're heat and AC.
To run off, yeah,
Electric, I believe.
100% electric then?
Yes, yes.
they have the boiler system in there, so. Okay, for sure, but it is tied to the electricity.
So what we came back with is a 2-phased approach. Phase 1, replacing the HVAC and the cupola. And that comes in at a lovely price tag of $1.5 million. That would involve demoing the existing cupola and the HVAC system above, and then rebuilding the cupola and putting the 5 new units above.
I'm going to, is it currently 5 units that are up there?
Maybe there'll be some Vista incentives. I don't know. Probably not enough to make a dent in $1.5 million.
Why, and would the new ones provide more energy efficient?
Yeah.
And so be cheaper M&O on running this.
Yes, that would be correct.
Well, it'll be cheaper if it's natural gas for the heat. If it's all electric, it's probably gonna be more expensive.
I texted our Jason Hips, he's
Our
our
facilities
facility maintenance guy,
manager.
he'll tell me.
Okay.
So I'm not trying to be rude, I'm just trying to
No,
find
that's
out.
Oh,
fine.
no, you're good.
So the second phase of this would be to replace the roof structure over base 2 and 3. And it is being proposed that we would leave the existing roof, which is metal, and go over with a new metal roof. And we're looking at over $3 million for the roof, just on those 2 buildings. And I will add, a study needs to be done on all of the roof structures at the Fair and Expo. We definitely are experiencing leaks throughout. And in June, one day we were cleaning up after the show, the rains came in. There was literally water coming down in front of our concessions windows in the plaza. So our guys are great. They go up there a lot. They're trying to patch things, but it could be melting or raining and hitting in one spot, and then it rolls down and comes through another spot. So it's been something that's been a challenge for a long time that we've done our best to work with, but definitely it is time to look at making these upgrades.
Has the metal membrane failed, or is it flashing or connectors that has failed? I mean, do you know what the point of entrance is for water?
We do have some speculation that the screws are popping. So that's creating some of the issues on the roofing.
Okay,
But we haven't had a full assessment to really determine what is causing this.
yeah, I mean, it just to replace a full metal roof, or I've never seen anybody do another metal roof over the top of a metal roof. That's an interesting idea. But usually with this kind of metal roof, it's the fasteners or the flashing that has failed. And so I just question whether you need to do a complete re-roof, whether it's just a matter of coming back and resealing and stuff. So anyway, so have you had somebody do an analysis on it?
We haven't done a full
Okay.
analysis on it.
Okay.
Do
Okay,
you know what that would cost to do? an
We could work
analysis?
on that.
Well, I think that's what the request is, would be to go forward with an RFQ to bring a firm on to more formally analyze it.
okay,
Arnold, Wills and Facilities, they looked at it very closely to help propose a plan. They identified like a roof hugger overframing purlin system that would go between the existing roof and the new roof. But until someone really gets in there and looks at it,
yeah,
we really don't know.
no, yeah, okay.
I would say that would be what I would like to see happen before we invest $3.5 million is to really have someone come in.
And then, yeah, maybe
Yes.
we could at the same time review a number of the roof structures that are failing and get a better idea for a whole plan. I like that. Ron, if we could go to the next slide, please. That's okay. As Doug mentioned, the next steps are, we would like to initiate an RFQ process to select an architectural and engineering firm to complete construction design docs and the construction admin. And that'd be planning for phase 1 with the phase 2 option. The estimated time frame is 10 to 14 months. So the phase 1 funding, as we said, is 1.5 million. The Fair and Expo feels comfortable that we could contribute $250,000 to get this process going. We need to make a capital fund request for 1.25 million. And then if we are to work towards phase 2 with over $3 million investment, we would need to work with the budget office and our CEO to explore options through capital planning for 2023 and 24 or beyond possibly. Our department is also working on, we're reviewing our rental rates, our user fees, our operational expenses. Obviously, our goal is to get towards being able to fund some capital projects and plan for the future. And that hasn't been done in the past with the Fair and Expo. So it definitely is a big undertaking. We have 97 acres and a lot of structures to review, but we know that it is time to do that. So we are requesting today the approval to utilize the 250,000 of our department funds towards this project and to initiate an RFQ process to select and enter into a contract with an architectural and engineering firm so we can get the designs in the works and that we have a better understanding of where we're going with these projects for phase 1 and an option for a phase 2. We are requesting eventual capital funding for the remaining amount, currently estimated at 1.25 million to complete phase 1 of the HVAC and boiler replacement. And then we'll hope to have more precise estimates moving forward. And again, it's going to take up to 14 months for this project to get things going.
My concern is over 10 to 14 months, we're going to see a lot of rain between now and then. I know we're bound by RFPs and RFQ, but if we have a structure that is actively leaking every time it rains, don't we have a way around that where we can call some commercial roofing construction company and say, can you come out and please assess? We have an something is actively failing on our roof, and just get a company out there to go up and look. I mean, I mean, 10 to 14 months on something like that, I think is putting our assets in danger out there. So I mean, can we just make a call to somebody and say, hey, when's your first available time to come out and tell us what's wrong with our roof? I mean, without going through an entire RFP or RFQ process. I mean, just because like Commissioner French said, I mean, if it's just, oh, you've got flashing here, or like you said, you've got a couple screws that are popping. If it's something as simple as that, that's not going to be 3.15 million to fix, but we got to get somebody who has expertise to just come out and look.
No, that makes sense.
Can
yeah.
we, and I don't know, I mean, maybe this is a question
Talk
for
to
Tony.
purchasing,
Yeah, maybe this is a question for Tony in purchasing of like, hey, this is the situation. Every time it rains, this happens. We don't have time to do an RFQ for this.
Yeah, we might.
How
be
do
able to
we, how do we make
simulate
this
it.
happen?
Yeah,
So,
I mean, it's pretty extreme. It does
Uh-huh.
impact a number of booths throughout the buildings.
Yeah.
When the show's going on. And I know our staff has tried to mitigate where they can.
Yeah.
In some repairs, but we could talk to
Yeah.
purchasing. We have a company out right now doing a new membrane roof on our concessions garden, so.
but I mean, if it's like a seam or a flashing that runs the length of the building or something, I mean, that can be just repaired as opposed to ripping off the whole or recovering the whole building with a brand new, I mean, I think we should at least explore that.
That's.
Our staff
Yeah,
has, yes.
Yeah, so your
they
staff
have.
has tried to assess.
But like I said, it's tricky because where the source starts isn't where the leak may really be coming out
Yeah.
of the ceiling. It will, just as the slope.
Yeah,
of
it'll
the
slide
roof
down
is-
and
yeah,
drip wherever.
especially if the snow melts off.
Question, and it might add some clarity for Commissioner Kearns. The request is to do an A&E RFP for 250 to assess not only the design needed for the HVAC, but also for the roof as well, to assess the roof.
To select a firm, proceed with the HVAC as the current priority, but have the option to then utilize the same firm down the road, should funding become available, to do a similar design for the roof. Okay, at that point, but right now the HVAC is prioritized ahead of the roof at the current time based on user feedback.
And the 10 to 14 months is from RFP issue to completion of the project, not just for the design.
Yeah.
Right?
Yes, correct.
But that's just on the HVAC part of it. It's not on the total roof.
Correct.
Yeah, and the cupola.
We've
yeah.
not done a timeline on the roof.
So wondering if we ought to do, because I mean, we've got great people out there that know how to maintain this stuff, but I wonder if it would be helpful to include with this RFP or either a secondary one to have a roofing company come out that's experienced with metal roof membranes and have an assessment done to see if there are some, maybe not a full replacement, but a surgically address areas that need to be improved, whether it's the flashing, whether it's rivets, whether it's something like that. So it seems like that's be better to either combine them into contiguous efforts as well.
That's
And then we could look at the procurement process for, does this constitute an emergency that we could bypass some of our procurement policies?
So contiguous efforts, but not necessarily the same firm doing
Right.
both.
Right.
Yeah.
Yep.
And
Have
so,
a roofing company do the roofing assessment, have the A&E, because we know we need to replace the HVAC units. Let's get that one moving forward.
yeah, so my suspicion, I'd be anxious to hear what you have to confirm it, but my suspicion is that those HVAC units are natural gas. And if they are, then we've got until June to replace them. Otherwise, then it goes to 100% electric with heat pumps that won't work in the winter. And that'll be a whole nother problem we'll have to deal with in terms of how to generate heat out there. So anyway.
Fortunately, Jason's off. Today, Jason's off, not scheduled to work tonight. text him to see if he was replying. He hasn't replied. So
We've been working on him with that.
Yeah.
But take your day off. So
Yeah,
he's
it's-
really good about it.
It's okay. I mean,
We can follow
find
up.
out.
I can send you an
tomorrow.
email.
Yeah, I know the architectural firm recommended electric units as the replacement ones and again, that firm may not be selected to do the work. They're just who we have to help put together a recommendation at this point. They describe the current units as mechanical, whatever that, I'm not clear honestly, whether that means electric, natural gas or otherwise, but they did identify or suggest.
Do we have any supplemental heat in these buildings like natural gas heaters up in the ceiling or anything that?
Don't, and the heat portion does seem to still be working. It's the
Okay.
AC that has
That's what's
been
already,
an issue for a number of
Okay.
years. Yeah.
all right. Well, I mean, once you get people in there and stuff, air conditioning becomes the problem.
It-
You know, the challenge is when you're setting up and when you're just moving in there, there are not enough people to generate the heat, and so you need to augment it with some other source. Otherwise, the space is gonna be cold. Okay,
So are you anticipating that these would be the RFP approval and then whatever you come up with for an assessment for the roof to be on like next week's consent agenda for commissioner action?
We would work with the budget office to see what needs to be done to move
Okay.
the funds, because I think they'd have to go through the
Budget,
process. So
budget appropriation too.
I think Aaron would work to do that next through the
Yep.
budget and agenda process if you're supportive of the direction.
What are your thoughts on running the phase one process?
I think we need the units.
I think on the roof, I just want to make sure that we it's really the roofing companies that are going to know what the true need is versus the architectural company.
If I ever leave
Valid
my
point.
roof, I'm not calling an
An
architect.
architect.
I'm gonna call a roofing company to come out and
Yes,
tell me what's wrong.
that is correct.
Yeah, and we know the architectural companies contacted a few roofing companies, but it's not always the same as having the company come out
Yes.
and look in person, and I think we can definitely arrange for that to happen with these same funds.
That'd be quite fun.
Okay. Okay, then I'm happy to have you guys move forward and then, really look at that and figure it out. And on the, HVAC side, yeah, it's trying to figure out or on the air conditioning side and the heat side, so the architects need to figure out the cupola. Is that how you say it?
Yeah.
So because that's the basis of that, is that failing as well?
There may be some leaking in the structure, but I haven't really heard that. It's going to involve some major cranes coming in to lift all of those units out of there, so they will have to dismantle
Yeah.
it.
Basically have to remove it, take it apart in order to replace the units, and there will be a portion of the roof on the very top.
So partly why we're doing that, I mean, that to me, then having a roofing company on board would be crucial, because then they would be able to see what's going on inside as well, or at least be able to analyze. And we're probably gonna have to, with that cost, probably even emergency, probably still have to do a couple of bids. I don't know.
We may want to, just because we get a couple different ideas on
Yeah.
most cost effective options.
So I would just want to make sure that as we're, looking at the air conditioning side, then with the roof being open, that'd be perfect time to have the roofers come in and take a look as well.
Yeah, I think the
That's true.
concern was just the overall cost for the project and whether it would be feasible to do all at once or over time.
And making you aware of it.
Yeah. No, I
You have to
appreciate you
get some real numbers.
making us aware. I think, we understand the air conditioning units have to get changed out. We understand the roof, something has to be done for the roof, but I don't think we all know what that is. And so I can't commit to $3.1 million at this point in time.
Yeah, which is why we were very, trying to be clear, we're sharing the estimates that were shared with us with a grain of salt, if you will, and the additional
Yeah,
work that would need to be done to have a much better figure.
very good.
So if you're gonna open up those, what are you calling it?
The
Cupolas?
cupola?
So if you're gonna open those up to take out the units and then put the units back in and then rebuild the structure around, is it cheap? Do we have to put the units on the roof or can we just put the units behind the building?
We wouldn't have any space to do that.
Oh. You just said we have 98 acres. What are you talking
I
about,
know, but you can't run a line long enough for the south parking lot
Aaron?
to get to, but I like. what
Okay,
they're
I was just
doing.
wondering, I don't know, I mean, do they have to go back up on the roof? Or can we
It is
just
the
put
best
them behind the
place.
building? I don't know.
With all the move in and move out and all the access doors on our buildings, you just don't have
Okay.
a really good spot.
All right, okay.
And I don't see them having to tear down the whole cupola to get these units in. You could tear down, open up a part of the wall at the end of it, just slide the things in. They're not that big a deal. So.
Great.
Yeah.
Well, thank you all for the great input and we'll keep you posted as we move forward. Thank you. And then I'm going to transition into a fair update. Are you excited? Are you ready? We're
Excited.
2 months away. I think it's gonna be a fabulous fair this year. It's gonna be the real deal. Last
Our
year
theme
was good to
again?
be back. All systems go.
All systems go. There we go.
Nothing is stopping us this year, so we're really excited. Our concerts are selling really well. I mean, historically, the best that I've seen in 18 fairs, so that's exciting. The document that we've provided you and Ron has so kindly put up on the screen there is that with labor shortages and cost increases, we have the last couple months been wrapping our heads around what we're foreseeing as projected increases for the fair this year. And the biggest number you'll see on here is our security. And that's gonna be about $90,000 extra. Unfortunately, our longtime security company had to step away from doing the fair because of staffing shortages. They just didn't feel that they could handle the fair this year. But we have been able to secure a new company. But our rates are going up more than double to accommodate this need. So if you look here, traffic control, again, we're adding some hours, some more bodies. Wages have went up a little bit. The porta potties have went up. Our decorator is having to hire folks at a much higher rate, so that's being passed on to us. The security, we will have increased law enforcement for the fair this year. And our parking services, again, they're facing challenges as well with staffing. A lot of them travel in from out of town. Hotels are more expensive. And then the big thing that we're navigating, which I was highlighting some of you on, is our Geiger crews. They, as I mentioned, are a huge asset to the fair. We are anticipating that to be greatly reduced, but hopeful they will still be able to help us at a limited capacity. They are integral throughout the day in getting the grounds prepped for our guests, cleaning all of our buildings, helping in the livestock areas, operating forklifts, making sure the grandstands are clean and ready for our guests every day. And then the biggest piece is the trash removal throughout each day of the fair. There's so much generated and they have a great system in place with their carts and their crews that come through. And we really pride ourselves on having such a clean fair and we get a lot of feedback on that. So this, we're exploring some different ideas on how to get some more labor, but we do see some increased costs with that as well. So right now, our estimated total is about $129,000.
Aaron, can you tell, what is the decorator?
So that is pipe and drape, skirted tables,
Oh, okay.
tents.
Gotcha. Okay, okay. Okay,
So-
because I was even gonna say, I think the only things that we put up are the pipe and drapes.
Yes, yeah,
That's what it is.
nothing
Okay.
extra.
So it's not actually decoration.
No,
Okay,
no, no.
I gotcha.
Yeah.
Okay.
So Ron, if we could please move to the next slide. kind of just want to rip off the Band-Aid first on those increases. With our budget overview on the second page, Bill and we're very optimistic. It's going to be a great fair. So our projected revenue, we had budgeted, which again, we put the budget together before fair happens each year at 3.8 million.
That's actually a lot. 3,800,000.
Oh, sorry. Yes, you're correct. With that, we are anticipating, we're gonna have great attendance numbers this year. We're going to see increased food commissions. We'll see increased parking revenues, carnival commissions. And we think, with that in place, it's going to help offset these projected overages. And the only place we're really seeing budget wise where we go over is what we call professional services. And that's where the security falls into place.
And again, it's just that we're gonna go over the expected budget. It's not necessarily meaning we're gonna run short cash or anything of that nature. But we do have reserve. We do predict that we will go over our budget or our over estimate for the revenue wise. Again, just a prime example is on the food side, roughly on average, it's a 22% commission that we get. So for every $100,000 they increase, we're getting another $22,000. So, and then again, also on the carnival, it's the same thing. It's around 20% commission on that. We know they've raised their bracelet prices because we have to get permission from them to sell carnival wristband bracelet vouchers ahead of time. They tell us what we can sell them for. And so they have raised that, but Aaron's had positive feedback from the carnival companies on the locations they've already hit, and people are coming. People are spending money at the carnivals. And so again, money, if they charging more, then we're getting a little bit more. And so we just know that our budget that we had to put together, last August, September of last year to predict what we were going to do here. We didn't all predict that, we were going to have to pay $55 an hour for security, that, law enforcement was going to cost us 90. Hotel rooms were going to be on average, what, 150 a night for our people? Where in the past years, we were able to work some kind of trade outs or something like this, sponsorships with people. And they're not doing that now. They want the money. And so it's costing more to do things and for our people to come in and do that. So now, and again, we've taken and we've cut back on a few things, like the entertainment budget's $700,000. But we chose not to do a fourth concert because the other three were doing so well. So we are able to save some of that money to help.
Yeah, there's about $50,000. And I think I was talking in the beginning, the nice thing about 2 of our 3 concerts, they are on track to pay for themselves. And when I say pay for themselves, for the artist fees. So that's fabulous that those will be, somewhat a break even. And the entertainment, like we said, we've been conservative with that. Something we're thinking about and we wanted to talk with you is raising our parking on Saturdays and Sundays from $5 to $10. Just again, we are projecting that could bring in an additional $70,000 in revenue.
And those are our high flow days. And so, it's kind of a two-prong approach on that. We're trying to hopefully maybe move some of those people that would come on the weekends to maybe, if it's $5 during the week to park, then we'll go to during the week instead of, because people are waiting in line to get into the fairgrounds.
Once we're full, it's hard to continuously turn the lot on the weekends. But the other thing we're doing, and we did this last year, is we're operating a shuttle from SCC that's very affordable. And by riding the shuttle, you'll actually receive a discount at the gate when you buy your admission ticket. And that will be available every day. So that's a great incentive for people that may not want to pay the parking fee in general. And they can park off site and not be caught up in all the traffic, especially on the weekends when we're seeing over 40,000 attendees on a Saturday. So Some of the other areas I just outlined for reference for you are the 5 key areas that really take up the bulk of our budget, and Bill started down this path with the $700,000 for the entertainment. That's everything in the grandstand, that stage lights, the artists, the free entertainment on the grounds, the mutton bust and the racing pigs. So it, catering, all of the things that are tied to providing entertainment at the fair. And then you can see salary and wages there, which we touched on, but bringing on those temporary workers, our staff's time, professional services, again, being security, parking, traffic control on the street, sheriff's department, our judges, the Geiger's crew, our on-site electrician. Then we roll into fair premiums, and that's the prize money that we pay out to folks that enter into the fair. And then we have rental equipment, forklifts, heavy duty pieces of equipment to have that grandstand ready for the demo derbies, the truck pulls and the rodeo.
And the porta potties for
Yeah.
and LC, that great.
So overall, we feel good about everything. It's just, these are the challenges we're all facing right now, but we feel like they're navigatable for us. And again, it's gonna be a great fair. So,
And again, we just wanted to bring to light that not gonna be asking for money. It's that, look, we're gonna have to come in and say, we're gonna need to increase the budget because we are gonna go over because of these unforeseen expenses. And again, a prime example on the salary side. When I estimated that extra help cost last year, we were all thinking, 30 to 40 cents for extra help. Well, Labor Department comes out in October and says, oh, by the way, it's going to go up 80 cents, double what your projections are. So, and this year it's kind of scary because inflation is where it is, and that minimum wage increase goes up with inflation. That's how they part of what they use to calculate it. And the scary part is we submit the budget before it's even.
So that's why it's a budget. It's an estimate at that point in time.
Yeah.
And
But again.
nice to see you're working to continue to further refine it. So thank you.
do you have any questions for us?
I don't think so. You guys did a great job explaining and helping us understand. So but we're excited for the fair.
Good, we are too. It's gonna be fun. Perfect weather, all 10 days.
Be great.
Well, thank you for your time today.
Which show is selling the most tickets?
Nelly,
Oh.
yeah, big, almost the 2,000 tickets sold, so we're excited. Yeah, usually our push is, just the weeks before fair, people really make a big push to buy their tickets, so we're happy to see that. El King has really turned out to be a pretty big attraction for us too.
Good.
Well, good to
Thank
see
you
you
very
all in
much.
person. Thank
Nice to
you.
see you too.
Anything I'm concerned about, the revenue might be high because I am on a diet.
I think Al needs to be the one that introduces Nelly.
Yeah.
Special off-stage appearance. Yeah. I will sing back up. Yeah.
Being hot here.
For joining us.
Good morning, commissioners. Thank you for the opportunity to brief you today. We have one ordinance that we're going to go over, and then just a real quick discussion on a resolution that we asked to have put on this tomorrow's agenda. First thing is complete streets. Thank you, Ron. So this started a while ago. Next slide, please. In 2011, the state legislature passed this act encouraging local governments to adopt their own complete streets ordinance. We've been talking about it for a while. We've been part of the conversation with the cities and are to the point that we wanted to get our own adopted, and we'll get into later the reasons why we want it. Next slide. So this is the language out of it. There They're context sensitive, which means it matters where you are. It's not a one size fits all. And really, we're just trying to formalize what we already do when we look at road projects. That's what I would tell you. We're always assessing them for all modes of transportation. Is there a need for bike access here? Is there a need for pedestrian access? Are the ADA facilities adequate? Anytime we're looking at any road project. So really, it's very much in keeping with how we do business currently. Next slide. So Scott had looked at the presentation, asked me to include a couple of cross sections, and I apologize, they're so small. This one is out of Mill Road, and this is the section north of Hastings. And you can see we got the 3 lanes, the center turn lane and the 2 outside travel lanes. But it's real typical for us on minor arterials, which is what Mill is, to put in something like you see here, the bike lane on the outside. So there is a place for bicyclists outside of the travel lane. It makes a much safer situation for them, doesn't add a whole bunch of width. Also, you know, in the event that a car breaks down or something, there's a place for cars to be. So that's always a good extra. And then we have, in this case, we have integral sidewalks just because of right-of-way constraints. We always try and separate the sidewalks if we can on arterials. It's just nicer not to be walking right next to traffic, right? We've all had that experience. If you're right next to a busy high-speed road, it's not always the best walking experience. It does get you where you want to go, but look for that separation if we have right-of-way. That's not always the case on arterials, though oftentimes we're constrained by existing development. Next slide. So that was the urban example. This is a rural example. This is, which one is this? From which I gave you. Is that Brooks? Okay. Brooks Road is the one that we're working on currently. Another example of this would be Denison Chatteroy Road up north. If you've ever driven that, it's the connection from 395 to Highway 2, and it's a very good road. Really happy with the way that turned out. And what we do in those, I get the next one. Yeah, that's right. Ron's messing with me. It's Monday morning. Thank you. Yeah, I know it's so small. That's my fault. So these, similar to the urban setting, you know, having that outside shoulder, that 6 to 8 feet, again, gives cars that break down a place to go, or people that need to stop to take a phone call, get oriented on where they're going. It gives a place for that, but also gives a place where people can walk and bike safely, more safely. So, you know, in a rural application, this is much more appropriate. Obviously, putting curbed and separated facilities in rural settings, very hard to maintain, really not appropriate for the place. So that's that context sensitive. When we're in rural areas, this is what we look to do. And it meets the needs, and it's easier for us to maintain long term too. So that's the rural example. Next slide. So what we're trying to accomplish, you know, for me, really the ones I want to hit on are number 7, using best practice design and the flexibility. You know, this ordinance doesn't constrain us to certain requirements on every road. We can look at the area and look at what the needs are and develop a road section that's appropriate, you know, and make places. We have a bicycle path plan, and we have pedestrian routes, obviously more focused on where the generators, you know, where are people trying to get to if they're walking? Are we near a school? Are we near a shopping center? And just make it appropriate for the area. So we do retain that flexibility inside of this ordinance, which was really important to us. We don't want to be chained to doing things that don't make sense and having to pay for them and try and make them fit. So that's a big thing for us. It does complement the way we currently do it. Next slide. My favorite part, the exceptions. We do want to keep control of this because, like I said, I've had ordinances in the past where we end up with requirements that are very hard to implement. We just don't want to do that. So the exceptions are where uses are prohibited. That's an obvious one. But where the cost is disproportionate to need and use, we can't afford to do everything everywhere. We all know that. Budgets are what they are. Ordinary maintenance and repairs, we don't get into this if we're just doing, you know, say a chip seal on a road. It doesn't trigger the need to take a look at this. We may of our own accord do that, but it's at our discretion at that point. And then exceptions can be made by the county engineer. Next slide. So this is the why. TIB has a separate bucket of money. You can apply for projects that are complete streets oriented. So that's really the why of what we want to do. It's primarily to meet our grant agencies are both offering individual buckets that are just for complete streets, and we get additional scoring. We get points on a number of grants, and I think the next slide shows that. And we're already doing this. I mean, that's really the short answer. We don't go out there and not consider pedestrian and bicycle needs. So it's really in keeping with how we do current business, and it does leave us flexibility to, you know, do appropriate things. And if we don't have the money, we don't have to do it, because that does come up. Next slide. This is the last one. Oh, go ahead.
Go ahead, finish yours.
Yeah, so this is the last slide, and again, there's that one bucket, and that does vary year to year for TIB. And then also other TIB programs, STBG, Safe Routes to School, Bike Ped, all those have points in the scoring that are directed at having a complete streets ordinance. So it's advantageous to them. We've been doing well with these grants, but this just means that we do a little bit better. So it makes sense for us to have one. That's all I got.
And so I sit on the TIB board, and I can kind of reinforce what Matt is saying. When we evaluate projects, if you have a formally adopted program, whether it's complete streets or, you know, bypass or whatever, you score higher in the review process and stuff. And so if you don't have a policy, it's pretty tough to get any money out of TIB without some kind of formal policy saying that this is something the community is actually pursuing and stuff. So some communities have done extremely well. And so I'm really happy that Matt's bringing this forward. It will improve our competitiveness as we try and get more money coming to the area.
Okay, any other questions or comments on that? Okay, thank you. So we'll be moving that forward. Hopefully received a draft version of it. It's not a long piece of ordinance. It's 3 pages. So pretty quick read if you're interested, but it just basically encompasses what we already talked about. And the other thing is, we asked to have something put on regarding Brooks Road. We need a formal acceptance of the grant. It didn't get formally put in yet, so we just need to do that for grab. They're asking for it. And inside of that, it has your standard language about allowing the county engineer to sign additional documents in the future on behalf of the board.
And that's on our agenda for
Consent for tomorrow, yep.
Okay, so
And that's all I got. Any other questions on Brooks or Patriot Streets?
Yep.
Okay,
Thank
all right.
you.
Thanks, Ron. Have a good day.
okay, thank you too. Okay, that takes us to Jeff Morris on ARP planning.
So just a quick update today. Yes, sir.
So I know I mentioned it to Scott. I don't think I mentioned it to you. It would be really valuable if I could have at least 10 minutes of your time for an executive session item to bring you up to speed on something before the noon hour, if at all possible.
Okay.
Thank you.
Yeah, we just have the miscellaneous after this.
Great.
Okay.
I'll be quick. Last week, water storage closed. I'm sorry, this week, water storage closes. Last week, broadband other closed. We will score, we've already been through the broadband. We will add the water storage this week and then bring both of those to you for a first pass next week. And then with the summer recess, you know, final votes would be the first meeting in August. Tomorrow you will see 4 items on consent. The first one is the medical expenses category. These 3 all closed 2 weeks ago. What is on that one is $145,000 for 2 Spokane Valley Fire Department trucks with basic life support units. The 2 categories to the medical examiner, one for cold case DNA analysis, the other for autopsy kits, particularly looking for substance use in cadavers, kind of playing off some of what you heard this morning on fentanyl. And then to Spokane County's risk management. And those are direct COVID expenses related to the county being self-insured. So that will be a total of 833. thousand. That's 533,000 over what was in the category. You had 300,000, we're funding 833,000. Second category you'll see tomorrow is water and sewer and the infrastructure. City of Fairfield had a project that was fully funded through CDBG. We're adding 195,000 to cover their cost overruns, just the inflationary world we're living in. The urban water district out in the valley a ways, a water pipe system for just over $500,000. Total project is 1.3 million, so we're about 40% of it. Clear Lake out on the West Plains, just under $500,000 for a $2.3 million project. So we're a smaller piece of that gap funding, also pipe replacement transmission. And then Otis irrigation out in Otis Orchards, 950,000 towards a $2.4 million project. That category you put in 2 million. We're actually funding 2,143,000 and change. So about another 144,000 we're going over there. Third category is under clean water, water conservation. The first one is 675,000 to county parks. That's the one redoing some irrigation systems, primarily in our golf courses. So it will be a water saving system as well as a cost saving over time. We're fully funding that, being as ourselves. Newman Lake is a water conservation project, water quality issues there. That's a $2 million fully funded to ourselves again. And then the East Spokane Water District had a $113,000 request for fire suppression enhancements. They had another 171 for a total of 285. So that category we went over 888,000. So 3 of what you see tomorrow will be one resolution per category. The fourth one is putting in the roughly 1.5 million additional funds to cover the fact that once you take the vote, you will be choosing to go over. Originally, 2 categories had 2 million each and one had 300,000 for 4.3 million. And we're funding about 5.8 across the 3 categories. So you will see that on consent tomorrow. We've had one-on-ones with all of you, so you've seen this before. Any questions? So, and roughly speaking, you've funded about half of the proposals that came in.
Some of them they requested, but they were in wrong categories. They didn't fit that
Some of the wrong
criteria.
categories, some of the requests were, one was over 18 million, so it's just outside the scope of reality. Financially speaking, don't mean to be mean, just it was a lot of money for a category that only had $300,000 in the bucket. So, but yes, and you'll see that on consent tomorrow.
Thank you. Nice to see this getting out to the, for the names that are out there.
Some of the first checks will be going out in the next week or 2 for reimbursements. One thing I just forgot looking at Arian. Next week will be your chance. So we have to report in July for our year-end report. ARP is on a June 30 to June 30 fiscal year. So Arian is working on the annual report as well as a quarterly report that's due. And she will be presenting those briefly to you next week. If you have any feedback for them before the final actually be in submission, the submission happens by the end of the month.
We're also backfilling the awards that you did prior to the CLA application portal coming online. So Whitworth has been finished, and then we also have 2 other water districts and Anovia, as well as entering in not only CLA, but ourselves. So all of those are kind of getting backfilled in so that they are a part of that standalone repository.
Does that affect the fee that we're paying?
No, not at all, not at all. No, it was inclusive of all of the fee. It just allows it to be standalone and us to reconcile and require reports before the checks go out the door.
Just additional work for Arian.
Other duties as assigned.
Other duties. Yes.
At what point do we want to discuss, sort of with the second allotment of funds that have come to the county, when we are discuss sort of what other categories we want to put money toward, not specifics or, or releasing RFPs yet, but just the discussion of how much we want to put in each of the other category. I mean, at some point.
Well, our recommendation, because of all the reporting due this month, would be to start that the first meeting in August when you're back.
Okay.
Just because we're quite busy right now, especially the first time through the reporting, figuring out their system.
Sounds.
Well, then you'll have to be able to really summarize for us everything. we
Give you a
spent.
summary where everything is, how much is out the door, how much is still yet to be RFP'd, and then bring around again all of the unsolicited ideas in our repository. I guess we solicited them, but they're not funded yet for you guys to look at to inform what categories you want to put money into.
We're also waiting for some feedback on some other funding sources that might be better fitted for some of the conversations that we've had for asks, and that might impact how and what the RFPs go out the door and or additional allocations from the second tranche.
Other questions for them? Okay. Thank you. That takes us to miscellaneous. Scott, I know you have one.
Yeah, we wanted to give a briefing on the right-of-way grant that Commerce has issued out, that we've been working with the city of Spokane Valley. Jeff and Aaron have been involved with that. So Jeff's got a document he's gonna hand out and go over. This is their kind of the first pass at a 30% of the grant. What has come out from a kind of working team that's been coming together. And the information is for your consideration. We understand that the city council may be taking action on this tonight, the Spokane City Council, and then Spokane Valley Council may be taking action tomorrow night on it. So recommendation for the board, if you're supportive of this, is to allow those jurisdictions to do their issue their support, so we know it's joint and unified, and we can come in behind it if that's something you're supportive of. But let Jeff go through the details.
So the top one, some of the reason I've been jumping jacking out of the meeting today is we just got this letter sent to us. And so you'll see on the back, 3 city council members who are the working group have signed it, as well as the mayor from the city of Spokane. You've all seen the grid as far as the 7.2 million. Don't see any changes on that from what you've seen prior. And then just a couple of paragraphs, and we put it into this memo format. The second piece of paper I gave you was some questions that we sent over to the city. The words in red are the response from the city. The only thought I would have for your consideration on the letter would be right before the actual graph of how the money is going. Right after it says 30% is 7.2 million, we recommend is below, to clearly state, as we asked the question in number 1 on the other page, that it would be the city of Spokane that will be serving as the fiscal agent for this, because the way the no-flow is written, it could be interpreted as the county, particularly one of the buckets of funding is it's a new, what do you call those fees? A document recording fee that goes directly to the state. It's a fee that was passed in the 21 legislature. This pot of money is some of its first funding allocation out of Olympia. But due to some of those nexuses and the city really taking the lead on this overall, with us being their wingman, to use a Top Gun Tom Cruise quote, just kind of clearly stating that. And then you'll see the other questions. One thing to take note of, one of the 3 pots of money has a 40-year operating requirement with it. And so our thought, being your staff, was to try to put the $6 million for the Quality Inn hotel purchase that Catholic Charities would be running from that pot because they're an organization that will likely be around in 40 years. However, the NOFO, in talking with the city, says the Department of Commerce will choose what pot of money to fund out of, just based on what they think is best. We have let the city know that we thought it would be good to request that pot of money to be used for the hotel, being such a big sum of money and that 40-year requirement. I don't know if there's any skin off your nose one way or the other, just wanted to throw it out there for awareness and then get your feedback on what you want to do with the letter.
So I guess, question for Mark. I mean, I think if we're gonna, you know, one of the things that Scott and I talked about was ensuring that the city council and the mayor, our office, were working together on this, because it's like, I don't want to get in the middle of in between the two, because there's been different proposals on lots of different things regarding homeless, and this to me has to be a coordinated effort that everybody's if we're gonna sign on, just in support of this, I would want to make sure that our letter is stating that we are signing on in support. We do not want to be the fiscal agent because we're not going to be the ones administering these funds. Just to make that clear. We don't need an MOU or anything like that, I don't think at this time, but just in a letter form, ensuring that it's clear that this is, we're signing on, in support, but we are not taking any fiscal responsibility, that we're happy to let them direct those funds for the entire region. I think we want to make sure that we're talking about it because this is regional money for the entire county. It's not just city of Spokane dollars. And so we want to make sure that we're clear that, we're going to let them do this for helping people in the region.
Understood. Thank you.
Would it be amenable that below the current signature block, there's some text that actually reiterates the above that says in support with the city of Spokane as a fiscal agent, and you're below that so that it underscores that, or do you want a separate letter?
I almost think we just want to have a letter that's attached to this one.
Okay.
Instead of trying to sign on to theirs. Right. I think that's going to be clear. I don't think we need to wait for the city of Spokane Valley, because I think they need to get this in ASAP. My understanding on this 30% side.
I think their desire is as I understand it, the 21st of July is what they have to have the entire request in, but the city's trying to accelerate it and get an early, some early momentum on 30% of the ask.
Right, but that's what I want to make sure that even as they're putting in for the 30%, it's clear that we are not the fiscal agent to commerce and all of that. So I'd rather, I think the city council, they're taking this up tonight.
So we understand.
So maybe we can take it up tomorrow under miscellaneous to do that, but have maybe a letter ready to go that we can look at after the consent agenda.
Yeah.
Yeah, like I said, I just wanted to be clear that we're not in the middle of what the city council is deciding versus what the mayor's office is deciding, because they have different thoughts and approaches, but they've come together at least on this 30%.
The way the NOFO is written, it appears highly likely the Department of Commerce, like with the hotel as an example, it'd actually be a Commerce Catholic Charities contract versus passing through the city. At least that's how my layman's reading of it would read. So I don't think it'd be any big deal at all for us just to reiterate, we're not the one actually implementing this. We're not the fiscal agent.
Catholic Charities actually received 1.2 million from that same pot of money for this application. This would be an additional. So to Jeff's point, it would be to everybody's best interest for that to just tack on to a document that's already in existence.
So you'd like Erin and I to work on a letter?
Yeah, along with Mark.
Does Mark take first lead as a lawyer? He knows how to say stuff.
I would give them something to work with, like a draft.
I'd appreciate that. Thank you.
Okay.
You may want to get him the info though, so he's has a chance to read that quickly. And highlight kind of where we think the fiscal agent section is.
And then bring this back tomorrow with the 2 o'clock meeting.
Yeah, and then we'd still have to take public testimony. We're gonna take action on it. And we can take action. You know, for it to be signed at other than a public meeting, but we'll still have to do a public comment. And that'll give us a chance to see what happens tonight at the city council and then where we're at on a letter, but I think it's gonna have to be attached to this. Not, you know, on their letterhead.
That's
Great. Thank you. I know that's been a lot of. Grant, maybe not quickly, it's been a lot of work for all of us, so thank you both for being there for some of the meetings that Scott and I couldn't make. Are there any other miscellaneous items? Seeing none, Mr. French, you've got to state with the purpose and all that.
Yeah, it's the view of performance of a public official. And it'll just take 10 minutes. It's by way of an update, and appreciate if it's just the 3 commissioners, Mr. Simmons and Mr. McLean. And no decision.
And Commissioner CUNY, I would need 5 minutes in executive session for pending a potential litigation under 4230-110 I or C1I. Okay, thank you.
So 15 minutes is total what we're gonna need, and who, Mark, do you need anyone else in that meeting other than the 3 commissioners, yourself and Scott?
That's it.
Okay. So a total of 15 minutes,
And I don't anticipate any action either.
okay, for the items that were just spoken to. So it's 11:34. We anticipate to be in executive session for 15 minutes. And it'll probably take us a minute to get into that executive session. So I'm gonna say 11:35 to 11:40. No, 50. Okay, and no action will be taken. Thank you.
Commissioner, Mark's advised us we want to have the following motion made to continue our agenda items for tomorrow after our 2 p.m. consent.
Okay, would someone like to make a motion to continue our items into tomorrow after our 2 o'clock?
Is that a motion or is that just something we're stating for the record?
I think it'd be a motion. You'll need a motion.
Madam Chair, I would move that we move the balance of the agenda to tomorrow afternoon's 2 o'clock legislative meeting to be addressed at the end of the 2 o'clock legislative session.
I'll second that motion.
Do I need to take public comment?
Quickly open it, I would, yes, anytime we're doing final action.
Okay, I have a motion and a second to move the rest of our items from today to after our 2 o'clock legislative meeting tomorrow. I will open this up for anyone that would like to discuss that. Let's see. Star 9 or raise your hand. See no one in here. Second call for anyone wishing to testify on moving some of our agenda items till tomorrow. Third and final call, seeing none. I will close the public hearing and we have a motion and a second. All those in favor of continuing our meeting till tomorrow afternoon, please say aye. Aye, motion passes unanimously. Thank you. Okay, so it is 11:36 now. So we will now go into executive session. Thank you.